This patient is deaf. Because everyone was wearing a mask, she was unable to read lips. So using the iPad, this is how we were able to communicate. During this 2020 pandemic, many people have been unable to see their doctors. Either they stayed home out of an abundance of caution due to underlying conditions, or the doctors had closed their offices during the lockdowns. That's the case for this lady here. The last time she saw her podiatrist was in early March, and that doctor closed the office and will remain closed until sometime in October. So she has not been seen in a long time, and she can no longer wait to get her feet taken care of. Fortunately, the aide that was with her today, who by the way is also deaf, followed me on YouTube, and so she was able to contact the office and make an appointment for a friend. This was a very unique office visit for me. I've had deaf patients in my office plenty of times, but this was the first time I've had a deaf patient since the pandemic lockdowns. Everyone is wearing a mask, of course, so the patient and her aide were unable to use their skills of lip reading. So what we ended up doing was I used my iPad, as I showed earlier on in this video, and the aide used her cell phone to type out messages. And so we were able to have a very good, very complete, very concise visit through the use of modern technology. Actually, it was a whole lot of fun, and we all kind of laughed at the situation, but we were also very impressed at how we were able to get through the visit without losing any information and still being able to have a good doctor-patient relationship bond. This good lady has had this fungal toenail problem for several years. She has a podiatrist she had been seeing on a regular basis until the pandemic lockdowns back in March. This being the middle of August, she has not been seen for foot care in about 5 months. And her doctor's office would not be open again until October, another 2 months. So going 7 months without any foot care for her was out of the question. Again, fortunately, her friend, who is a YouTube subscriber, recommended that she come and see me. And we met today and everything went very well. She has the textbook example of toenail fungus. Her nails are thick, brittle, dry, and have a lot of debris under the nails, or what we call subungual debris. She also has the classic color change that we often see with this condition. The 10-minute foot soak made it much easier and much more comfortable for her to tolerate getting her nails trimmed. She didn't have any pain or any discomfort at all. I used the curette to loosen any debris on, around, and underneath the toenail. If the debris is not loosened, it makes it harder to remove later with the drill burr. Combined with the water, you'd end up with this white, pasty, gooey mess around the nails. You may also notice how curved or dome-shaped her nails are. This is due to the years of buildup of debris underneath the nails, pushing them up, giving that curved shape or the shape of a dome. After many years, this can become very uncomfortable, especially when wearing shoes, as the shoes press down on top of the thickened, hardened nails, making it very uncomfortable or difficult to walk. Because her nails are so thick, I chose to use double action nail nippers. These nail nippers are great for dealing with this type of issue. I can trim the nails easily without much force from my hand, therefore making it easier for me and much easier and much more comfortable for the patient. Occasionally, I get comments where viewers will say that these patients are either lazy or unsanitary or don't care or all of the above. And actually, nothing could be further from the truth. For some people, doing their own foot care is very difficult or very difficult to do safely. With arthritis of the major joints, including the knees and the hips and the back, it can be difficult to reach down and to put the foot in the right position in order to render their own foot care. Some may have visual disturbances. Others may have diabetes, where it's recommended that they do not do their own foot care anyway due to issues with neuropathy and decreased circulation to the feet. So no, these folks aren't lazy. These folks really do care about their health. They really do want to get their feet in a better position and a better place. So we podiatrists are here to provide that for them. Another recurring question I get in the comments section is, where are the family members? Why is no one helping this person out? And the answer to that can be very complicated. Sometimes patients are too embarrassed to show their family members, even family members that live in the same house, what's going on with their feet. If a patient lives alone, and many of these patients actually do live alone and can't take care of themselves, then they're left to their own devices. If family members come over to visit, they'll ask about their loved one's health issues, or maybe check blood pressure, or maybe do a finger stick for diabetes. But often they don't look at the feet. They don't ask about what's going on with these particular issues. So it's not just incumbent upon the person with the issues, but all of us, when we visit our family members who are elderly or otherwise have difficulty take care of themselves, just take a brief moment to take off their shoes and their socks and take a look to see what's going on with their feet. And if it looks like there's some significant issues, take some action and make an appointment for them to see a podiatrist. Viewers will also ask why, in cases like this, I cut the nails so short. What you have to keep in mind is that this is not a cosmetic procedure. These are medical procedures to reduce the nail thickness and the nail girth, and ultimately to reduce the fungal count in the nail, so that when we get to the point of treating the fungal infection with medication, whether it be topically or by mouth, we have less to work with, less to work against. And it makes it much more comfortable for the patient, easier for him or her to wear shoes. This is a small soft tissue nipper, often used to trim cuticles. I use them in this case to trim the thick skin that is developed under the nails due to the thickness and the buildup from the fungal infection. This hard skin can act just like a corn or a callus, making it very difficult, very painful for the patient, especially when wearing shoes and trying to go about their day walking around. This lady also has hammer toes, a deformity which makes the knuckle of the toe more prominent. So as she wears shoes and the feet move back and forth with each step every day, day in, day out, week in, week out, months and years, the skin responds by forming these hard, thick layers of skin called corns. So they can be very painful. You can get inflammation underneath these corns. We call that a small form of bursitis. So what we do is trim them down with the surgical scalpel. Use padding, recommend wider shoes, recommend shoes with a higher toe box to make things more comfortable. Recently, I've developed a method of releasing a steady stream of water droplets onto the patient's toes while I use the drill and burrs. This eliminates the nail dust and eliminates the friction burn, and it makes it much easier for me to do my work and much more comfortable for the patient. I place an absorbent pad on the floor so there's no mess. Also, there's no spray all over the patient, all over me, or all over the equipment and floor. Patients who have been coming to me for some time enjoy this method because not only is there no dust and no mess, but the warm water droplets are very soothing. Nail burrs come in many shapes and sizes and are made of either metal, plastic, ceramic, or stone. The choice of burr depends on the type of nail that we're dealing with. I like these round burrs because the teeth are a bit sharper and they're very good at grinding down thick toenails like this good lady has. Viewers have also asked, why not just remove all of the toenails and start from scratch? Well, number one, that's an awful lot of anesthesia to shoot into a person's foot to remove all 10 toenails. Number two, many people have diabetes, or advanced age, or other issues that cause poor circulation, so they would not be candidates for that amount of surgery. And number three, in the time it would take all 10 toenails to regrow, medication, be it oral, topical, laser, or otherwise, would be just as effective and take just as long for there to be a good result. So it makes no sense to send someone through the trauma of having all 10 toenails surgically removed when you get the same outcome in the same amount of time as medication. In these cases where toenail fungus is highly suspected, I will collect the nail samples in a little bag and send them to a lab. The lab will look at them under the microscope and to identify seen fungus, and then they will also do DNA tests to identify the organism or organisms that are causing the infection. I collect as much sample as I can in case the lab has to repeat any test. Here's what was collected from this case. So if you have health issues, including foot health issues, that have gone unaddressed because of the pandemic and the subsequent lockdowns, now's the time to find someone who can help you with these issues. Go online, give them a call, find out what their safety practices are. How are they social distancing? What are they doing for folks who have underlying conditions that are afraid to come and want to make sure there is enough isolation for them to be safe and to feel safe. So I hope we're out there being safe and conscientious and wearing masks and practice social distancing and taking care of ourselves.
This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up. To see very interesting cases and my approach and techniques to dealing with them, and to learn how you can improve your foot health, subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Follow me on social media at DC Foot Doctor. Most importantly, take care of your feet.